Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on conjunctivitis. So let us see what is conjunctivitis. Conjunctivitis is a pink or red color in the white of the eye, swelling of the conjunctiva, the thin layer that lines the white part of the eye and the inside of the eyelid and or eyelids, increased tear production, and the feeling like a foreign body is in the eye or an urge to rub the eye. What is pink eye or conjunctivitis and what are its symptoms and causes? Pink eye is an inflammation of the transparent membrane that lines the eyelid and eyeball. This membrane is called the conjunctiva. When small blood vessels in the conjunctiva become swollen and irritated, they are more visible. This is what causes the white of the eyes to appear reddish or pink. Pink eye, also called as conjunctivitis. Pink eye is most often caused by a viral infection. It can also be caused by bacterial infection, an allergic reaction, or in babies, an incompletely open tear duct. So, though pink eye can be irritating, it rarely affects your vision. Treatment can help ease the discomfort of pink eye because pink eye can be contagious. Getting an early diagnosis and taking certain precautions can help limit its spread. What are the symptoms? The most common pink eye symptoms include redness in one or both eyes, itchiness in one or both eyes, a gritty feeling in one or both eyes, a discharge in one or both eyes that forms a crust during the night that may prevent your eyes from opening in the morning, tearing, sensitivity to light called photophobia. When to see a doctor? There are serious eye conditions that can cause eye redness. These conditions may cause eye pain, a feeling that something is stuck in your eye, blurred vision, and light sensitivity. If you experience these symptoms, seek urgent care. People who wear contact lenses need to stop wearing their contacts lenses as soon as pink eye symptoms begin. If your symptoms do not start to get better within 12 to 24 hours, make an appointment with your eye doctor to make sure you don't have a more serious eye infection related to the contact lens use. What are the causes? Causes of the pink eye include viruses, bacteria, allergies, a chemical splash in the eye, a foreign object in the eye, in newborns, a blocked tear duct. What are the viral and bacterial conjunctivitis? Most cases of pink eye are caused by adenoviruses but also can be caused by other viruses including herpes simplex virus and varicella zoster virus. Both viral and bacterial conjunctivitis can occur along with cold or symptoms of respiratory infection such as sore throat. Wearing contact lenses that are not cleaned properly or are not your own can cause bacterial conjunctivitis. Both types are very contagious. They are spread through direct or indirect contact with the liquid that drains from the eye of someone who is infected. One or both eyes may be affected. What is allergic conjunctivitis? Allergic conjunctivitis affects both eyes and is a response to an allergy cause substance such as pollen. In response to allergens, your body produces an antibody called as immunoglobulin IgE, and which triggers a special cells in the mucous lining of your eyes and airways to release inflammatory substances including histamines. And your body's release of histamine can produce a number of allergy symptoms including red or pink eyes. If you have allergic conjunctivitis, you may experience intense itching, tearing, and inflammation of the eyes, as well as sneezing and watery nasal discharge. Most allergic conjunctivitis can be controlled with allergy eye drops, and allergic conjunctivitis is not contagious, and cromolyn eye drops can be given in this condition. Conjunctivitis resulting from irritation from a chemical splash or foreign objects in your eyes also is associated with conjunctivitis, and sometimes flushing and cleaning the eye to wash out the chemical or objects causes redness and irritation, and symptoms which may include watery eyes and a mucus discharge usually clear up on their own within about a day. If flushing does not resolve the symptoms, or if the chemical is a caustic one such as lye, see your healthcare provider or eye specialist as soon as possible. A chemical splash into the eye can cause permanent eye damage, and ongoing symptoms could indicate that you still have the foreign body in your eye, or you should also have a scratch on the cornea or the membrane covering the eyeball called the conjunctiva. What are the risk factors? Risk factors for the pink eye include exposure to someone infected with the viral or bacterial form of conjunctivitis, exposure to something you are allergic to or allergic conjunctivitis, or you are using contact lenses, especially extended wear lenses. Complications are in both children and adults. Pink eye can cause inflammation in the cornea that can affect vision. Prompt evaluation and treatment by your healthcare provider can reduce the risk of complications. See your healthcare provider if you have eye pain, a feeling that something is stuck in your eyes, blurred vision, or light sensitivity. What is the prevention? Preventing the spread of pink eye or conjunctivitis is by a good practice of good hygiene to control the spread of the pink eye. For instance, don't touch your eyes with your hands. Wash your hands often and use a clean towel and wash clothes daily. Don't share towels or wash clothes or change your pillowcase often, and throw away old eye cosmetics, and don't share eye cosmetics or personal eye care items with others. Keep in mind that conjunctivitis is no more contagious than the common cold. It's okay to return to work, school, or child care if you are able to practice good hygiene and avoid close contact. However, if work, school, or child care involves those contact with others, it may be best to stay home until you or your child's symptoms clear up. What are the preventing measures for conjunctivitis in newborns? Newborn eyes are susceptible to bacteria present in the mother's birth canal. These bacteria often cause no symptoms in the mother. In some cases, these bacteria can cause infants to develop a serious forms of conjunctivitis known as ophthalmia neonatorum, which needs immediate treatment to preserve the sight. That's why shortly after birth, an antibiotic ointment is applied to every newborn eyes. The ointment helps prevent eye infection. I would come for diagnosis. In most cases, your healthcare provider can diagnose conjunctivitis by asking about your recent health history and symptoms and examining your eyes. Rarely, your provider may take a sample of the liquids that drains from your eye for laboratory analysis called a culture. A culture may be needed if your symptoms are severe or if your healthcare provider suspects a high risk cause, such as a foreign body in your eye or a serious bacterial infection or a sexually transmitted infection. What is the treatment? Conjunctivitis treatment is usually focused on symptoms relief. Your healthcare provider may recommend you using artificial tears, cleaning your eyelids with a wet cloth, and applying cold or warm compresses several times daily. If you wear contact lenses, you will be advised to stop wearing them until treatment is complete. Your provider will likely recommend that you throw out soft contact lenses if you have already worn. Disinfect hard lenses overnight before you reuse them. Ask your healthcare provider if you should discard and replace your contact lenses accessories such as the lens case used before or during the illness. Also replace any eye makeup used before your illness. In most cases, you do not need antibiotic eye drops since conjunctivitis is usually viral. Antibiotic would not help. They may even cause harm by reducing their effectiveness in the future or causing a medicine reaction. Instead, the virus needs time to run its course. This typically takes around 2 to 3 weeks, and viral conjunctivitis often begins in one eye and then infects the other eye within a few days. Your symptoms should gradually clear on their own. Antiviral medicines may be an option if your viral conjunctivitis is caused by the herpes simplex virus. Treatment for allergic conjunctivitis. If the irritation is allergic conjunctivitis, your healthcare provider may prescribe one of many different types of eye drops for people with allergies. These may include medicines that help control allergic reactions such as antihistamines and mast cell stabilizers, or your healthcare provider may recommend medicines to help control inflammation such as decongestants, steroids, and anti-inflammatory drops. Non-prescription versions of these medicines may also be effective. Ask your healthcare provider about the best option for you, and you might reduce the severity of your allergic conjunctivitis symptoms by avoiding whatever causes your allergies. So, what is about the lifestyle and home remedies in relation with the conjunctivitis? To help you cope with the symptoms of pink eye until it goes away, try to apply a compress to your eyes. To make a compress, soak a clean lint-free cloth in water and wring it out before applying it gently to your closed eyelid. Generally, A cool water compress will feel the most soothing, but you also can use a warm compress if that feels better to you. If conjunctivitis eye affects only one eye, don't touch both eyes with the same cloth. This reduces the risk of spreading pink eye from one eye to the other. Try the eye drops. Non-prescription eye drops called artificial tears may relieve symptoms. Some eye drops contain antihistamines or other medicines that can be helpful for people with allergic conjunctivitis. Then stop wearing contact lenses. If you wear contact lenses, you may need to stop wearing them until your eyes feel better. How long you will need to go without contact lenses depends on what causing your conjunctivitis. Ask your healthcare provider whether you should throw away your disposable contacts lenses as well as your cleaning solution and lens case. If your lenses are not disposable, clean them thoroughly before reusing them. Preparing for your appointment, start by seeing your regular healthcare provider if you have any eye-related sign or symptoms that worry you. If your symptoms persist or get worse despite treatment, your provider may prefer you and he will refer you to an eye specialist, which is ophthalmologist. Because appointments can be brief and because there is often a lot of ground to cover, it's a good idea to be well prepared for your appointment. Here's some information to help you get ready for your appointment and what to expect. What you can do: be aware of any pre-appointment restrictions at the time you make the appointment. Be sure to ask if there's anything you need to be doing in advance, such as stop wearing contact lenses or refrain from using eye drops. Write down any symptoms you are experiencing, including any that may be unrelated to a reason for what you scheduled the appointment. Make a list of all medications, vitamins, or supplements that you are taking. Write down questions to ask during your appointment. Your time with your doctor is limited, so preparing a list of questions can help you make the most of your time together. List your questions from most important to the least important in case time runs out. For conjunctivitis, some basic questions to ask include: what's the most likely cause of my symptoms? What kind of test do I need? What treatment are available, and how long will I be contagious after starting treatment? Is there any generic alternative to the medicine you are prescribing me? Are there any brochures or other printed material that I can take with me? What website do you recommend for me? Do I need to come back for a follow-up visit? In addition to the question that you have prepared to ask, don't hesitate to ask additional questions and what to expect from your doctor. Your provider is likely to ask you a number of questions. Being ready to answer them any may allow time later to cover points you want to address. You may be asked, when did you begin experiencing symptoms? Have your symptoms been continuous or occasional? How severe are your symptoms? Does anything improve your symptoms? What, if anything, appears to worsen your symptoms? Do your symptoms affect one eye or both eyes? Do you use contact lenses? How do you clean your contact lenses? How often do you replace your contact lens storage case? Have you had close contact with anyone who has conjunctivitis or cold or flu symptoms? What you can do in the meantime: stop using contact lenses until you can see your provider, and wash your hands frequently to lessen the chance of infecting other people. Don't share towels with other people for the same reason. So this was all about conjunctivitis, and I hope so that this topic would be more informative for you, and you would have liked this video. And if you have liked this video, and don't forget to subscribe my channel. Thank you for listening this video. Have a wonderful nice day.